നമസ്കാരം, ഏവർക്കും ലേൺ സൈക്കോളജിയുടെ മറ്റൊരു ക്ലാസ്സിലേക്ക് സ്വാഗതം. ഇന്ന് നമ്മൾ ചർച്ച ചെയ്യുന്നത് MA സൈക്കോളജിയുടെ സൈക്കോപതോളജിയിലെ മുൻവർഷ ചോദ്യങ്ങളും ഉത്തരങ്ങളുമാണ്. നമുക്ക് ക്ലാസ്സിലേക്ക് പോകാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ: ഡിസ്കസ് ദ ഡയഗ്നോസ്റ്റിക് ഫീച്ചേഴ്സ്, കോസസ് ആൻഡ് ദ ട്രീറ്റ്മെൻറ്റ് ഫോർ ഹിസ്ട്രോണിക് പേഴ്സണാലിറ്റി ഡിസോർഡർ. Histrionic personality disorder is a type of personality disorder in which the affected individual displays an attention-seeking and excessively dramatic behaviors beginning in early adulthood and present across the broad range of situations. Individuals with histrionic personality disorder are highly emotional, charming, energetic, manipulative, seductive, impulsive, erratic, and demanding. The term histrionic, which means a theoretical in manner. DSM-4-TR classified histrionic personality disorder as a personality disorder. More specifically, histrionic personality disorder is classified by DSM-4 as a cluster B, a dramatic, emotional, or erratic personality disorder. The personality disorder which comprise cluster B include histrionic, antisocial, borderline, and narcissistic. DSM-4-TR lists 8 symptoms that form the diagnostic criteria for histrionic personality disorder. An individual having at least 5 of the below characteristics must be considered to have a histrionic personality disorder. First one, center of attention. Patients with histrionic personality disorder experience discomfort when they are not the center of attention. Second one, sexually seductive. Patients with histrionic personality disorder displays inappropriate sexually seductive or provocative behaviors towards others. Third one, shifting emotions. The expressions of emotion of patients with histrionic personality disorder tend to be shallow and to shift rapidly. Physical appearance. Individuals with the histrionic personality disorder consistently employ physical appearance to gain attention for themselves. Speech style. The speech style of patients with histrionic personality disorder lacks detail, a dramatic behavior, self-dramatization, and exaggerate their emotions. Suggestibility. Other individuals or circumstances can easily influence patients with histrionic personality disorder. Overestimation of intimacy. Patients with histrionic personality disorder overestimate the level of intimacy in a relationship. Diagnostic features of histrionic personality disorder. Excessive attention-seeking behavior and emotionality. They feel unappreciated if not the center of attention. To express their emotion in exaggerated fashion. They are often seductive in appearance and behavior and typically concerned about their looks. Their style of speech may also be dramatic. Histrionic personality disorder may affect a person's social or romantic relationship or their ability to cope with losses or failure. Their sexual adjustment usually poor. Their interpersonal relationships are stormy because they may attempt to control their partner through seductive behavior and emotional manipulation. People with histrionic personality disorder, their self-esteem depends on the approval of others and does not arise from a true feeling of self-worth. Causes of histrionic personality disorder. The exact causes of histrionic personality disorder is not known, but many mental health professionals believe that both learned and inherited factors play a role in its development. The child of parent with his disorder might simply be repeating a learned behavior. Environmental factors that might be involved include a lack of criticism or punishment as a child, positive reinforcement that is given only when a child completes certain approved behaviors, and unpredictable attention given to the child by his or her parent. Psychosexual stage of development through which each individual passes determine an individual's later psychological development as an adult. Early psychoanalysis proposed that the general phase in determinant of histrionic personality disorder. Psychoanalysts agree that traumatic childhood contributes towards the development of histrionic personality disorder. Some theories suggest that the more severe forms of histrionic personality disorder derive from a disapproval in early mother-child relationship. Treatment of histrionic personality disorder. Histrionic personality disorder, like other personality disorders, may require several years of therapy and may affect individuals throughout their lives. Some professionals believe that psychoanalytic therapy is a treatment of choice of histrionic personality disorder because it assists patients to become aware of their own feeling. Cognitive behavior therapy, group therapy, and family therapy have been used for treating personality disorder. ICD-10 World Health Organization lists histrionic personality disorder is characterized by at least three of the following: self-dramatization, exaggerated expression of emotion, suggestibility easily influenced by others or by circumstances, continuous seeking of excitement and activities in which a person is the center of attention, inappropriate selectiveness in appearance or behavior, over concern with physical attractiveness. Cognitive behavior therapy. Cognitive therapy is a treatment directed at reducing the dysfunctional thoughts of individuals with a histrionic personality disorder. Cognitive therapy for histrionic personality disorder focuses on a shift from global suggestible thinking to more methodical, systematic, and structured focus on problems. Cognitive behavior therapy teaches individuals with a histrionic personality disorder to identify automatic behavior and to develop better problem-solving skill. Group therapy. Group therapy is suggested to assist individuals with histrionic personality disorder to work on interpersonal relationship. Psychodrama techniques or group role play can assist individuals with histrionic personality disorder to practice problems at work and to learn to decrease the display of excessively dramatic behavior. Group therapists need to monitor the group because individuals with histrionic personality disorder tend to take over and dominate others. Family therapy. To teach assertion rather than avoidance of conflicts, family therapists need to direct individuals with the histrionic personality disorder to speak directly to other family members. Family therapy can support family members to meet their own needs without supporting the histrionic behavior for the individual with the history on personality disorder who use set dramatic crisis to keep the family closely connected. Family therapists employ behavior contact to support assertive behavior rather than temper tantrums. Next question. Define and delineate the symptom of paranoia. What causes paranoia? Here the patient becomes a prey to premature delusion. In the disease, the cause of delusion is internal and no hallucination is involved. A paranoid disorder is a medical illness which happens to affect the brain and causes changes in thinking and feeling. Paranoia disorder consists of pervasive, long-standing, suspicious, and generalized mistrust of others. Paranoid individuals are eager observers. Paranoid persons are not a psychotic, but they get in socialization. The word paranoia comes from the Greek word indicating madness, and the term was used to describe a mental illness in which delusional beliefs is the most prominent feature. Characteristic features of paranoia. People with this disorder do not trust other people. The central characteristics of people is a high degree of mistrustfulness and suspicious when interacting with others. Some people are unable to afraid to form close relationship with others. People suffering from this disorder are very difficult to deal with. They never seem to let down their defense. They are always looking for and defining evidence that others are against them. Symptoms of paranoia. The main symptoms is permanent delusion. In paranoia, the symptoms of delusion appear gradually. The patient is sentimental, suspicious, irritable, introvert, depressed, obstinate, jealous, selfish, unsocially, and bitter. Social and family adjustment is not good. Anytime doubts about their friends and associates, self-referential thinking, thought broadcasting, magical thinking, thought withdrawal, thought insertion, idea of reference. Causes of paranoia: homosexual fixation, feeling of inferiority, emotional complex, personality type, heredity, biological, environmental or psychological, dysfunctional and cognitive processing, medical causes, associated mental illness, substance abuse. Next question. Discuss the features and the type of pervasive developmental disorder. Delineate the symptom of childhood dissociative disorder. The term pervasive developmental disorder, also called PDDS, refers to a group of conditions that involve delay in the development of many basic skills, most notably the ability to socialize with others, to communicate, and use of imagination. Children with these conditions often are confused in their thinking and generally have problems understanding the world around them. Because these conditions typically are identified in children around 3 years of age, critical period in child's development, they are called developmental disorder. General symptoms that may be present to some degree in a child with PDD include difficulty with the verbal communication including problems using the understanding language, difficulty with the nonverbal communication such as gestures and facial expressions, difficulty with the social interaction including relating to people and to his or her surroundings, unusual ways of playing with toys and other objects, difficulty adjusting to change in routine or familiar surrounding, repeat body movement or pattern of behavior such as hand flapping, spinning and head bending, changing response to sound, temper tantrums, difficulty sleeping, aggressive behavior, fearfulness or anxiety. Symptoms of autism. DSM-4-TR identifies 3 features that are associated with the autism. Impairment in social interaction. Individuals with autism fail to develop normal personal interaction in virtually every setting. This means that affected persons fail to form the normal social contacts that are such an important part of human development. The child develops interaction with the other, continues to be abnormal affect behaviors can include eye contact, facial expression and body postures. Affected children or adults do not seek out peers for play or other social interaction. In severe case, they may not even be aware of the presence of other individuals. Second one, communication. Communication is usually severely impaired in person with autism. What the individual understand as well as what is actually spoken by the individual or significantly delayed or non-existent. Inability to understand simple direction, questions or commands. The sentences are often very immature. Those with autism often repeat words or phrases that are spoken to them. This repetition is known as encholalia. Third one, behavior. Person with autism often exhibit a variety of repetitive abnormal behaviors. There may be also be hypersensitive to sensory input through vision, hearing, or touch. There are maybe extreme tolerance to loud noise or crowd visual stimulation or things that are felt. Wearing socks or tags on clothing may be perceived as painful. Sticky fingers, playing with the modeling clay, eating birthday cakes for other foods, for walking barefoot across the grass can be unbearable. There may be an underdeveloped response to the same type of stimulation. This individual may use abnormal means to experience visual, auditory or tactile input. A biological theory of autism. Several non-neurological disorders are associated with autistic features. Autism is one of the symptoms of these disorders. Tuberous sclerosis and the Fragile X syndrome, inherited disorder. Cerebral dysgenesis, abnormal development of the brain. Rett syndrome, a mutation of single gene. Some of the inborn errors of metabolism, biochemical or chemical defects. Childhood disintegrative disorder. Childhood disintegrative disorder is a condition in which children develop normally until age 2 to 4 but then demonstrate severe loss of social communication and other skills. Childhood disintegrative disorder, also known as Heller syndrome. Childhood disintegrative disorder is very much like autism. Both are among the group of disorders known as pervasive developmental disorder or autism spectrum disorders. Childhood disintegrative disorder is far less common than autism. Loss of developmental milestone may occur abruptly over the course of day to week, gradually over an extended period. Children with the childhood disintegrative disorder shows the following signs and symptoms. A dramatic loss of previously acquired skills in 2 or more of the following areas. Language, including severe decline in ability to speak and have conversation. Social skills, including significant difficulty related to interacting with others. Play, including loss of interest in imaginary play and in a variety of games and activities. More skills, including a dramatic decline in the ability to work, climb grass, objects and other movements. Bowel or bladder control, including frequent accidents in a child who was previously toilet trained. Autistic disorder. Autism is a developmental disorder that is characterized by impaired development in communication, social interaction, and behavior. Autism is classified as a pervasive development of disorder, a category of disorder that is often described interchangeably with the broad spectrum of developmental disorder, affecting young children and adults called the autistic spectrum disorder. The range of these disorders varies from several impaired individuals with autism to other individuals who have abnormalities of social interaction but is normal intelligent as per syndrome. The degree of autism can be ranged from mild to severe. Mildly affected individuals may appear very close to normal. Severely affected individuals may be extreme intellectual disability and unable to function in almost any setting. In the past, autism has been confused with childhood schizophrenia or childhood psychosis. Read's disorder. Read's disorder include the loss of purposeful hand use, screaming fits, inconsolable crying, loss of speech, behavior reminiscent of autism, panic-like attacks, grinding of teeth, rigid gait, tremors, intermittent hyperventilation, and microcephaly. Asperger's syndrome. Asperger's syndrome is one of the neurodevelopmental disorders that have effect on an individual's behavior, use of language and communication, and pattern of social interaction.